Hi, I'm Andrea Furlan, a physician specialist in physiatry, physical medicine rehabilitation, and I treat people with chronic pain. On this channel, I have many videos and people post questions about those videos, and today I'm going to answer some questions that people posted on previous videos that I published here. This video is not medical advice to those people who posted those questions. I will answer these questions more in general terms, because I think if someone asks the question, maybe there will be more people who have that question too. So I'll try to answer as many questions as I can today and to the best of my ability, so then this will help more people to get education and knowledge about pain, chronic pain, the treatments of pain. So let's get started with some questions. So which activities should be avoided for a person with narrowing of the neck spinal canal? Well, the spinal canal is where the spinal cord passes, and in the cervical spine, when there is a narrowing of the spinal canal, we call this cervical spinal stenosis. And if that stenosis is affecting the spinal cord, it may cause a disease called cervical myelopathy. I have a video on my channel about cervical myelopathy that you can watch. So what are some activities that a person with cervical spinal stenosis and cervical myelopathy should avoid? The person should avoid high impact activities, things like sports, contact sports, or jumping or running, because if the person has an injury to the cervical spine that is already narrowing in the canal is already narrowed, it may cause swelling, inflammation, edema, and that may compress the spinal cord and cause more damage to the spinal cord. They also should avoid heavy lifting, because that can exacerbate the symptoms of cervical myelopathy. Also, the person that has narrowing of the spinal canal and cervical myelopathy should avoid too much repetitive movements of the neck, but also avoid too much sedentarism, not moving at all. Like if the person works in a position in a desk work that they don't move their neck, they need to take breaks to do some range of motion exercises. But it's also important that the person with cervical myelopathy avoid alcohol and avoid smoking. Alcohol is inflammatory, and alcohol prevents calcium from being absorbed, which is really important for the bones, and smoking is really bad. Smoking cigarettes, cigars, or cannabis is bad because the smoke has a lot of toxins that block the blood flow to the bones, to the ligaments, which are very important for the nutrition of the spinal cord. If a person is not improving with duloxetine, can they take venlafaxine instead? Well, if a person is not noticing improvement in symptoms with duloxetine, which is an antidepressant that we prescribe for many different kinds of chronic pain, they may try a different one, and another one that is in the same class, the same family, is called venlafaxine. Both are antidepressants that are used to treat chronic pain. They are in the family of SNRIs, serotonin and norepinephrine reuptake inhibitors. The side effects of duloxetine and venlafaxine might be a little bit different. Both duloxetine and venlafaxine may cause sleepiness during the day and insomnia during the night. Venlafaxine may cause increase in blood pressure and may worsen some heart problems. Duloxetine may cause dry mouth, dizziness, nausea, and constipation. So if a person wants to switch from duloxetine to venlafaxine or venlafaxine to duloxetine, they can do that, mainly because of the side effects will be different, but they need to stop one medication before they start the other one. They should not take them at the same time. I have a video on my channel specifically about duloxetine for chronic pain. Can children have fibromyalgia? Yes, unfortunately they can. It's called juvenile fibromyalgia. Fibromyalgia is a condition of pain all over the body. When it affects children, it usually affects girls between the ages of 13 and 15 years of age. Fibromyalgia tend to run in families. Juvenile fibromyalgia is more common in children and teenagers who had a physical trauma, a surgery, an infection, or a strong psychological stressful situation. But in some children, the cause will not be obvious. It may be a combination of genetic factors and stressful situations that predispose the initiation of a central sensitization phenomenon. I have a video about central sensitization on my YouTube channel. Can a person take antidepressant and an anticonvulsant at the same time to treat pain? It is common to prescribe an antidepressant and an anticonvulsant at the same time to treat chronic pain. This is called polypharmacy. Some anticonvulsants like gabapentin, pregabalin, topiramate, carbamazepine, oxcarbazepine, they are the most prescribed anticonvulsants that we use to treat some kinds of chronic pain, like neuropathic pain. Neuropathic pain means that there is an injury, a lesion, or a disease of the peripheral nerves or in the central nervous system. Anticonvulsants and antidepressants, they act on the receptors in the nerves. They also act regulating the neurotransmitters in the central nervous system, like serotonin, noradrenaline, dopamine. So that's why we use antidepressants and anticonvulsants to treat some types of chronic pain. On my channel, I have a couple of videos that I talk about different anticonvulsants like gabapentin and pregabalin, and I also have videos of antidepressants like amitriptyline and duloxetine. What are some brain retraining exercises that we use for nociplastic pain? One of my favorite brain retraining exercises that I recommend to treat nociplastic pain is called somatic tracking. Somatic tracking involves a combination of mindfulness, safety reappraisal, and positive affect induction. The goal of somatic tracking is to retrain the brain when feeling a painful sensation, but through a lens of safety. This type of exercise deactivates the pain signal. It is like fixing the alarm system of the house because it was making too much noise just because it was deregulated. If you want to learn more about somatic tracking, I have a video on my channel that I demonstrate somatic tracking exercise. How can a person with cervical spinal stenosis and suspected myelopathy protect his or her neck when flying in an airplane? Should they use a special pillow? Should they avoid traveling by plane? There is a lot of acceleration and deceleration during a plane takeoff and landing. And if a person has instability of the cervical spine, there might be dislocation of the bones and one of the other one and may cause a spinal cord lesion. So for a person that knows that they have cervical spine instability, they need to talk to the doctor and first I'll ask if they are allowed to travel by plane or not. And if they can, they need to use a special neck immobilization to protect the neck, especially during takeoff and landing. Those commonly used neck pillows or comfort pillows or soft collars do not protect the neck sufficient to avoid any dislocation of one vertebra over the other one. If you want to learn more about cervical myelopathy, I have a video on my channel about that. Can people with cervical radiculopathy go to the gym? A person with cervical radiculopathy may go to the gym and do any kind of exercise. It really depends on what is the cause of the cervical radiculopathy and what they want to do at the gym. Is the cervical radiculopathy an acute event? Like the person was in a car accident or a motorcycle accident, or did they fall and break some bones? They had a fracture of the neck. If yes, it's better to wait until the acute phases passes, which will take a couple of weeks. And then they could return to usual physical activity, including going to the gym after the acute episode is healed. But even in an acute phase, they could go to the gym to do a treadmill and walk, or do some exercises with the lower extremities, like the limbs, the legs, and avoid movements of the neck and shoulders or heavy lifting. Now, in case of chronic radiculopathy, which is usually 3 months after the symptoms have started, then rehabilitation is recommended, and we recommend to start with gentle exercises, which could mean going to the gym. But I would recommend first the person to go to a physiotherapist and get a specific prescription or program of exercise that is safe for them. I have a video about cervical radiculopathy on my channel. Can peripheral neuropathy happen after one single episode of heavy drinking? Alcoholic neuropathy only develops in people who are heavy drinkers for a long time, not just after one episode of binge drinking in one night in one party. Alcoholic neuropathy develops over years that a person is using alcohol, mostly daily use of alcohol, and it happens because the alcohol will damage the nerves, causing a condition called alcohol-induced peripheral neuropathy. The symptoms of alcohol-induced peripheral neuropathy include numbness, tingling, burning, electrical shocks, and they usually affect the long nerves, which are usually starting in the feet and then the hands. A single session or episode of heavy drinking will cause intoxication in the person. And unless if they sleep in an awkward position, like with the arm in some positions that are stretching, especially the brachial plexus, which are all the nerves that go to the arm, sometimes because of this, they wake up in the morning and they have numbness and tingling and burning sensation because the brachial plexus has been injured when they were sleeping. But this is a temporary condition and it's reversible. It may take a few hours or even a couple of days to return, but it's not a permanent damage. If you want to learn more about the dangers of alcohol and pain, I have a video on my channel that I talk about alcohol and chronic pain. Is there a link between candida infection and fibromyalgia? Many years ago, there was a theory going on the internet that candida, which is an yeast infection, was the cause of fibromyalgia. And actually, that was a theory that has not been proven. So no, candida is not a cause of fibromyalgia. Candida is a yeast that is commonly found in the mouth and in the guts, the gastrointestinal tract, but it doesn't cause fibromyalgia. We now know better that fibromyalgia is more a disease of the pain system. We have central sensitization. There are problems with the modulation of pain at the level of the brain. So we know that it's a deregulation of the pain system. The mechanism is nociplastic pain. I have a video on my channel about fibromyalgia if you want to watch and learn more about this condition. Can radiotherapy cause burning feet? Radiotherapy, unfortunately, can cause a burning feet sensation. Fortunately, this is a rare side effect of radiotherapy. This is a condition called radiation-induced peripheral neuropathy. The symptoms are tingling, burning sensation, pins and needles, numbness, electrical shocks on both feet. It mainly affects the long nerves, but the hands can also be affected. I have a video on my channel about burning feet. The treatment for burning feet, which is a type of neuropathic pain, usually includes medications, and they may be either tablets or intravenous injections of medications to treat neuropathic pain. Fortunately, this is a rare side effect of radiotherapy, which is one of the treatments that are employed to combat cancer. If a person is prescribed pregabalin for pain, are they supposed to take it for the rest of their life? We usually prescribe pregabalin to treat chronic pain in certain types of chronic pain, like neuropathic pain, which is a disease of the nerve system, peripheral and central nerve system. Pregabalin is an anticonvulsant and can be used to treat chronic neuropathic pain. It depends on the cause of the chronic pain. The person may use for a short period or they may need to use it for the rest of their life. For example, If the neuropathic pain is caused by shingles, the person may need to use pregabalin just for a couple of weeks or maybe a few months until the viral infection is gone and the nerve pain is relieved so they can stop the pregabalin. Another example is if there is a nerve compression or a nerve damage or a trauma that affected a nerve or a surgery, they may need to use the pregabalin until that nerve regrows and heals, which may take a couple of months, sometimes even a year, depending on the size and the length of the nerve. But then once the nerve is regrown, the peripheral nerves, they regrow and the nerves are functioning again, they may stop taking the pregabalin. Now, if the person has a chronic condition that is causing neuropathic pain, such as diabetes, or they have multiple sclerosis, or other conditions that are chronic conditions that is causing chronic pain, they may need to take pregabalin for the rest of their life. If the person is using pregabalin for other conditions that are nociplastic pain, like fibromyalgia, complex regional pain syndrome, then they may stop after their symptoms are better. They may stop because they made lifestyle changes. They are moving more, they're exercising, they're sleeping better, their depression is better, they're more active, more engaged with their life. They may stop taking the pregabalin. I have a video on my channel specifically about pregabalin that you can watch and learn more about this medication. What is the best type of doctor to treat a Baker's cyst? Baker's cyst is accumulation of fluid behind the knee. The best type of doctor to treat a Baker's cyst is an orthopedic surgeon if the Baker's cyst requires surgery. But if the orthopedic surgeon says no surgery is indicated, that doing surgery will not relieve the Baker's cyst, they should treat with conservative treatment, then the patient should be seeing a different type of doctor. That could be a physiatrist like me. I'm a specialist in physical medicine rehabilitation. It could be a rheumatologist, and they could also be going to a physiotherapist, someone that will help them with exercises for the knee, for the muscles, and to improve pain. I have a video on my channel about Baker's cyst if you want to learn more. Should people do ice water immersion after they exercise? There are many people who are proponents of a ice water immersion after you exercise. They say this might be good for the muscles, for the joints. However, this practice is more common among healthy athletes. I have not seen this among people with chronic pain. And actually, there is not enough evidence to support this, either for healthy people or for people with chronic pain. I found a couple of reports in the medical literature that healthy people who do this, they actually have a worsening of the soreness, the muscle soreness that happens 2 or 3 days after the exercise. So it might not be a good idea, especially if you don't like ice water, very cold water, then I don't recommend you to do this kind of practice. Apparently there is no benefit in doing this, and it even may cause more soreness about the exercise after you do the exercises. Is it normal to hear cracking sounds when doing stretches? It is normal to hear cracking sounds when we are doing stretching of any joint in our body. This is usually caused by release of gaseous material from inside of the joint, even when we crack the knuckles of our hands. These noises are called crepitus. The person should be worried if the crepitus is followed by swelling or redness of the joint or extreme pain. Other than that, it's just hearing the noise, the crepitus, is not really a sign that you're damaging the joint. I have a video on my channel that I interviewed a rheumatologist, and she explained which situations the crepitus is dangerous and you should be worried about, but in the majority of cases, there is no reason to be worried. If a person has worsening pain after the exercise, should they stop it? Pain after exercise is quite common. Muscle soreness is normal. It's expected. It's considered normal. Muscle soreness is muscle pain that happens on the next day that you exercise, and it may last 2 or 3 days after you exercised. Now, if the pain, the muscle soreness, lasts more than 72 hours and it prevents the person from doing the activities that they need to do, their normal activities, then it might be a sign that there is some injury or lesion to the parts that were exercised. And even after they stop exercising, they still continue having pain. Maybe it's better to consult a professional to see what happened to that region, especially if there's swelling, inflammation, edema, redness in that area. But if the person just exercised and they have some pain after without any of those inflammatory signs, it may just be a sign that it's hurting, but you are not harming. I have a video on my channel about hurt versus harm, which is really important for the person, especially with chronic pain, to understand the difference. What's the difference between a buprenorphine in patch and a buprenorphine tablet? There are 2 types of buprenorphine that we use for people with chronic pain. One comes in a patch and the other one is a sublingual tablet. The patch releases the buprenorphine slowly. It contains very small doses in micrograms. And the patches that we have available in Canada, they go from 5 micrograms per hour to 20 micrograms per hour. They are indicated for people who have chronic pain and they need ongoing opioids, and the patch is changed every 7 days. Now, the sublingual tablet contains milligrams of buprenorphine, so 1,000 times more than the patch. But the tablets also contain naloxone. The tablets and the patches can be used for people with chronic pain, but the tablets are indicated for people who have some opioid use disorder symptoms. I have a video on my channel about buprenorphine if you want to learn more. What is the best way to reduce the dose of opioids without worsening of pain symptoms? The best way to reduce the dose of opioids without having a worsening of the pain symptoms is by doing a slow taper. A slow taper means reducing the dose by 10% every week or every 2 weeks. A slow taper allows the opioid receptors to adjust to the new dose without having a lot of withdrawal symptoms. Withdrawals from opioid cause headaches, muscle aches, abdominal cramps. So to avoid those symptoms of withdrawal, we recommend a slow taper. I have a video on my channel that I talk about tapering opioids using a program, using an educational program, motivation, and that can help a lot of people to reduce their doses of opioids. Can a person avoid knee replacement surgery? A person may avoid knee replacement surgery by doing some lifestyle modifications. First, moving more. Exercise, motion is lotion. That will increase the lubrication of the joints and reduce the pain. If they cannot walk on land or do exercise at the gym, they could start with an aqua therapy program. Second, lose weight. Even losing a few pounds make a big difference in how the joints are loaded, but also in the production of adipokines, which are substances that are pro-inflammatory. Third, quit smoking. Quit smoking cigarettes, cigars, cannabis. The smoke has a lot of toxic substances that aggravate pain, especially pain coming from the joints and bones. Fourth, stop drinking alcohol completely. Alcohol is toxic. Alcohol also does not let the calcium to be absorbed, and which is so important for the bone health. And fifth, an anti-inflammatory diet. Stop eating processed food, reduce the amount of salt, reduce the amount of sugars, and eat more fruits and vegetables. An anti-inflammatory diet makes a big difference in the symptoms of people who have knee osteoarthritis. I have a video on my channel about anti-inflammatory diet. Is there a maximum number of cortisone shots that a person can take? A person should not take more than 2 or 3 cortisone shots in the same joint per year. Too much cortisone in the joint causes damage to the cartilage and the bones. And even there are some people that they take cortisone shots for different joints of their body. Sometimes it's the shoulder, the knee, the hips. They should be careful because too much cortisone has side effects to the whole body, which may include osteoporosis, weight gain, increase in blood sugar, increase in blood pressure. People need to be really careful how much steroids they take. I have a video on my channel about steroid injections if you want to learn more. Can a person have fibromyalgia and myofascial pain syndrome at the same time? Myofascial pain and fibromyalgia, they look very similar, but they are not the same thing. Fibromyalgia is widespread pain, and it's pain with slight pressure in the muscles, the bones, the tendons, and even a little bit of pressure or touching the skin. Myofascial pain is deep muscle pain that you need to dig deep to find the trigger points, and it affects a region of the body, not the whole body. But myofascial pain can lead to fibromyalgia by provoking central sensitization. And people with fibromyalgia, they may have a superimposed myofascial pain syndrome, but they are not the same thing. Watch my video that I have on my channel about myofascial pain syndrome. You may have noticed that I have a book that I published about the 8 steps to conquer chronic pain. This book summarizes a lot of the content that I have on my YouTube channel. Basically, everything that I know about pain and chronic pain, I wrote here in this book, and it is for people who have chronic pain. If you didn't have your copy yet, you may order on any bookstore around the world where books are sold. My doctor said that I am catastrophizing. What can I do about that? Catastrophizing is a thought process. Catastrophizing comes from a field of psychology, and I talk about this in my book, Pain Catastrophizing, which is always imagining the worst possible scenario. And there are 3 domains of catastrophizing: helplessness, rumination, and magnification. So I'll give you an example of what is helplessness. If the person keeps thinking, there's nothing I can do to reduce the intensity of my pain. Another example of rumination is I keep thinking about how much it hurts. And magnification, I keep thinking of other painful events. So catastrophization is when the person believes the worst possible scenario will happen, and if it happens, it will be a massive catastrophe. Helplessness is a feeling of powerlessness or inability to influence a situation. Rumination is a form of thought that persists and is focused on a harmful content, resulting in anxiety and emotional distress. And magnification is a type of irrational thought that makes the problem bigger or gives more importance to the situation than it is. So pain catastrophizing combines worry, anxiety, and depression. The term pain catastrophizing implies that the pain is more threatening than it actually is. And there is an association between high levels of pain catastrophizing and more disability from chronic pain. So I talk in the book about how it is fascinating that we can change catastrophizing thoughts. This is a modifiable factor. This is something that we know it can be reduced. And we know once we reduce catastrophizing thoughts, the person will feel better. They will genuinely feel better. They will not think better. They will not be thinking more positive or, be worrying less about pain. No, they will actually feel better. So that's why if your doctor told you that you are catastrophizing, they're just telling you that you do need to solve these thoughts. And there are professionals that can help you. These are people who work with the mind-body connections. They can be counselors, psychotherapists, psychologists, psychiatrists, social workers, occupational therapists, family doctors. There are so many people that can help you with your catastrophizing thoughts. So don't fight them. Don't try to ignore them. Go and run and try to treat them as soon as possible. That's all for today. I hope those questions were answered properly, that you understand better your situation. Thank you to everybody who are posting comments on my channel. I actually read all the comments. If they make to the public site of the comments, is because I approved them. I have to approve one by one. When you write your comments, your questions on my channel, they go on a private area that only I see. And if I approve them, they go in the public area. That's why sometimes it takes a few hours or even days for them to appear on the public side of the YouTube channel, because they're waiting for me to approve those comments. Thank you very much for your questions. Keep posting questions on this channel and keep posting your comments. I love to hear how you are applying the knowledge on this channel, what you are learning, what you are disseminating and sharing with your colleagues. There is a sharing button on my channel that you can, when you watch a video, you can share that. You can even create clips. If you don't want to share the whole video, you can create a clip and send that clip to someone that you know will be benefited by this knowledge. Thank you for watching today. Hope to see you in the next video. Goodbye.